Um, like I always say, when you see a question, don't jump into the gun and try to like pick an answer. Well, time is always your friend, and the wrong answer is your worst enemy, right? So what we're going to do is just a few questions, and then we'll take a look at them, and then see. I will show you what you should do. Like try to like follow systematically. I have a video on how to answer questions, and then how to approach them, and just follow them, stick with them, don't change, don't rush, just try to pick the right answer as much as you can. If you can't, try to eliminate rather than looking for the right answer. And then you got to use your buzzwords, right? Those are the key words that will let you get to the right answer. So what is the initial management of this condition with stable vitals? One line sentence. Yeah, it's usually very difficult. They don't give you information. You have to figure it out. First of all, you got to go for the keywords and ask yourself which one is the most important. Is this one? Initial management. Maybe all of this can be used for that. But the word said initial. Maybe you've seen this question before and you pick something else and you think it's the same thing. Well, today the question says initial management. Initial, first. First thing you do, not second, no third, no fourth, or what you will do, or what other things will be done. It says what? Initial. And then management, right? We got to fix the problem, condition, and stable vitals. So there's three things. If I'm taking the test, I will underline, I'll write it down because you cannot underline on the computer. Just sit down, look at it. It said initial information for these condition and a stable virus. Then you go back. You said, okay, these are my buzzwords. Okay, connect the dot. Well, you're being asked to find the initial, and your buzzwords are condition and stable vitals. So before I can manage the initial, I have to know the condition. And the condition is an EKG. What condition is that? After you figure out the condition, bring your content. I always say bring your content. Questions are designed based on content. So every question, try to bring the content that you know and try to figure it out. I'm going to bring my content to answer this question. That's all. So first, we got to figure out, well, this is it. Right. I look at this, I look at this EKG, I said, it does not make sense. I don't see, every time I look at the EKG, the first thing I look for is the rhythm. Is the rhythm irregular? I look at this, I say, no, it does not look like this is a regular rhythm. I look from here to here, here to here. You can see the distances are not the same. There's only few things that can give you irregular rhythm. That is the way I do EKG. Don't memorize them. As soon as I look at it and say, oh, this is not regular. It can be AFib or a heart block. Those are the two things that can give you irregular rhythm. All other rhythms are regular. So is this an AFib or is it a heart block? I know this cannot be a heart block, right? I can't even see P waves. There is no P waves. So how would I tell this is a heart block? So definitely I know this is an atrial fibrillation. So that's your first thing. Condition first is what? AFib. And they said stable vitals. That means, well, I have time. If you have a video on EKG, how to and critical care in terms of management of this condition, AFib and other things. Now I have time. If you have time, that means this is not an emergency. You have time to fix the problem. In AFib, the content here, if it's stable, that means you can give them medication. Unstable AFib, get cardioversion. Therefore, this patient is stable. Therefore, I can give him medication. But I see heparin, I see coumadin, I see amiodarone, I see isosorbide. Well, this is a tachyarrhythmia. Do I give them anticoagulation first? Or I give them control their ventricular rate? And the treatment is to control ventricular rate. So atrial fibrillation, the priority intervention, which is the initial management, is to control the rate, the ventricular rate. Otherwise, they will become unstable. So the first thing you do is to give them amiodarone. And this is how you go through, you walk through the question. Then based on test taking strategy, why would heparin be better than warfarin? They are anticoagulation, right? So just by that, you'll be able to figure out and say, well, no, I don't think they are doing the same thing. These two are doing the same thing. And this is going to vasodilator, it's going to decrease your blood pressure. It's not anti-arrhythmia. It's not going to control your rate. Therefore, you got to pick this. And this is how you go through these case questions, and you go through one by one. You're trying to knock it down to figure out what is going on. The second question is very busy, but it's not. And then is aware of 5 clients at change of shift. Which client situation need immediate intervention? That means there's something not right that you got to figure out and say, hey, I got to figure out what is going on. The way to do this kind of question is to divide the condition, see if there's a combination. A client with acute diverticulitis, board-like abdomen, acute pancreatitis, periumbilical ecchymosis, intussusception, large brown stool, peptic ulcer disease, sudden onset of severe mid-epigastric pain, acute epidural, projectile vomiting. These combination correct or acceptable? And I said, you have to be sharp. That means these are the things that will kill the patient. If these things are not there, then they are expected. That's all. That means a breathing issue, electrolyte shock, sepsis, airway, and pain. So if you have acute diverticulitis, I'm being sharp, right? Board-like abdomen, I don't expect it. Board-like abdomen is sepsis, and therefore this is bad. Pancreatitis, I don't expect them to have ecchymosis, but sometimes they may have it. And if I see it, periumbilical, it means they're bleeding. They are in shock. That is B sharp. You see what the B sharp can do. Everything is there. They are in shock. That is bad. Peptic ulcer disease and the sudden onset mid-epigastric pain is abdomen. That is sepsis. They have perforated. You bring in your things together. That is perforation. Intussusception, large branch stool. I know intussusception, B sharp moment is current jelly stool. That means they're having what? Ischemia. If you have branch stool, you're doing great. So this is not good. This is not bad. Epidural, if you vomiting, you have ICP. And that is what? Neurological problem. You are being sharp. And this is how you break these kind of questions down slowly by slow, you tackle them. Therefore, you can tell that one is sepsis. You are being sharp, right? 2, bleeding. That is shock. You are being sharp. Intussusception, large 2, is unexpected. You don't pick it. Peptic ulcer disease, sepsis, severe abdominal pain from the B sharp. Epidural hematoma, 2 large, what? Episode of projectile vomiting. This is what? Neurological problem, bad problem. Bad problem. So we have what? One, two, four, and five. Three is okay. But this is a select or apply. This is the key. This is the test taking strategy. You should not be selfish to pick all answers. Just pick that is what you know, 110%. If you only know two, please pick it and walk away. Just don't be greedy, okay? Walk away. If there's four answer choice there, pick the two and walk away. Trust me. NCLEX will not give you five answers, five select or apply. They know that. Otherwise, you check, 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 check. They may give you five and only one answer is right. It's a test taking strategy. They are not going to give you all five bad stuff. There's no way. That means you're guessing, you keep on guessing and guessing. And it give you two out of five. So if you pick two, walk away and go away so that you can take your point and run away from it. Okay. A client with the history of the depression, I guess I did a number wrong or I moved them around. A client with the history of depression, stable on isocapside, presents to the emergency room with headache, nausea, heart rate of 110, and blood pressure of 180 over 110 after attending a cookout. Client does not remember what was served. Which of the following food choice the nurse should suspect as a cause? My computer is messing up, right? Which of these the nurse should expect, right? So this is you have to go through. It's a long question. Sometimes you get the easy question. Sometimes you get the long question. First, go for the buzzword, isocapside, right? Figure out what this is. Then you ask, why do I have headache, nausea, vomiting, heart rate of 110, and blood pressure? Why would I put what? Cook out there. There's something. These are connected. These medication with these symptoms, and I told you went to a cookout. It means patient ate something, right? Then I give you depression. So at least you ask yourself, there have to be something connected. A patient with depression take this medication, went out and eat something, and it's not feeling good. There's only few medications that can do that. Hypertensive, tachycardia, headache, and nausea. What do you think is the problem? All the answer choice is there. You have to figure out. This is test taking strategy. You said, what is connected to this medication with depression and my blood pressure too high? If you know your content and you something, at least something should be triggering in your ear that, oh, there's something I read about what? One of the medications associated with depression, and you go eat something, and then you have hypertension. And so this is what your body is asking you. I've just put it in a long question. You have to go fish it out. This is test taking strategy. Which of these antidepressant you think when you go eat something, it can make you sick, right? There's a couple of them. But which of this? So I give you options here. But this is giving it away. This is giving it away. The blood pressure over there. Blood pressure of 180 over 110 and headache is your key. So what is the problem? Why? You have what? Which condition will do that? And what food item will let this happen? Think about it. If you know the answer, you can put it down. But what do you think is most likely to cause this problem? I'm showing you, taking my time going through how you can analyze the question and you can pick the answer without any problem. If you don't know it yet, so it's fine. But if you don't know it, I can tell you most foods, okay, most of the food that you should worry about is what? Is it fermented food? Is it curried? Or is it aged? These are the three things you have to tell yourself, like, oh, what is this? Right? I see anything that is fermented, curried, aged, or sometimes smoked, right? Fried, it's not friend. This is fried fish. Fried fish, right? This is not cooked. Rice, most of the time when they give you rice, they're talking about celiac disease, right? Pork, even though it's a meat, it has to be either fermented or it has to be smoked or anything like that. So it has to be what? Something that is fermented and cured, aged, and smoked. And you see, as you go through, I'm not picking the answer, but I'm showing you I'm picking the answer choice apart, right? There is no aged cheese there. There is no fermented. I know this fish is fried, so I'll just put it there. This is fried fish, but it has to be smoked. So this is wrong answer, right? So, pork, even though it's a meat, either it's fermented or it's smoked, And rice does not contain the problem. Rice mostly is related to celiac disease. Therefore, the only thing that you left with is avocado. So avocado is the high rates of tyramine, and that is going to cause this problem. So pay attention. You see how I try to break down the question? Sorry, my computer is acting out with all these words as I type. Um, but the right answer is avocado. But the most important thing is to connect the dot that this is a MOI. First, recognizing this is MOI, and then you think about things associated with MOI, and one of them is avocado or tyramine food. Okay. Hopefully, there's no other stuff here. Which prescription combination should the nurse question? The same strategy, right? And let's just review new prescription for several clients. So I'm going to divide them into two and figure out which combination. You got to bring your pharmacology. I like pharmacology, so I like it should not be difficult. If you make it small, pharmacology will be friendly, right? Isosorbide, I've been giving what? Tadalafil, right? I take warfarin. I've been prescribed what? Sucralfate. I take digoxin. I prescribe nifedipine. You see, I'm not reading the question to confuse me. I'm trying to like break it the way I will understand it. Make the question your own. I'm not writing client taking. It's a waste of time. It doesn't give you anything. I go for the buzzword. Citrulline, prescribe sumatriptan, right? Lithium, prescribe Respiradon. Based on the question, there's something wrong. This is a buzzword question, right? It's contraindicated. If I have to question, that means those two combinations should not exist. It's a test taking strategy, right? Then you got to go bring your content. I always say bring your content. It's a bag of message. So first you go for your asked, what is being asked, question, the case, combination of medication, buzzwords, we've written them down and rewrote the question. Our bag of content is what we know, what we've studied before, what we learned for 6, 8 weeks before we go and take the test. Don't throw it away and ask yourself, look at each answer choice and say, isosorbide. Okay, it's a nitrate. What is tadalafil? It's also a nitrate. Why should I put it together? Yeah, no problem. It's not good. Warfarin. And I've been prescribed sucralfate. Well, warfarin is anticoagulation. Sucralfate is not anticoagulation. Why do you think we put it together? Oh, then you remember that what is sucralfate? It's used for like peptic ulcer disease. Does it decrease acid? No, it's a cement. It coats the inner surface of the stomach. Therefore, if I'm taking warfarin, I'm not going to absorb anything. You should not take anything with sucralfate. You got to wait for 2 to 4 hours before. Therefore, this is also a problem. Digoxin. And calcium channel blocker, what are the things you should avoid in digoxin? Hey, calcium, right? Too much calcium, right? Nifedipine, you need to increase your calcium. Bad problem. Citrulline, and then sumatriptan. Think about it. What is the combination? We can figure out what is the combination. If you recognize it, it's all content. Go back to your content. Citrulline is what? It's an SSRI, right? It's an SSRI. Then you ask yourself, sumatriptan is used for migraine. Why would I run away from the two? Is it compatible? Think about it. Who can help me out? Can somebody taking citrulline be prescribed sumatriptan? You have to bring your content, I always say. If you bring your content, you figure it out, right? So citrulline is an SSRI. Sumatriptan is used for migraine. Why would they put that in the question? Is it acceptable to take it? No, because sumatriptan used for migraine, it causes vasoconstriction through serotonin receptors. It also stimulates serotonin. If he stimulates serotonin and then citrulline also helping with serotonin, we have what? Serotonin syndrome. You should not take citrulline with sumatriptan together. You develop serotonin syndrome. Lithium, okay, risperidone. Well, lithium is a bipolar. Risperidone is an antipsychotic. You can use it for acute condition. There's no interaction between that. So you can see, this is what I told you. There's only one answer there. So which one you should question? We question this, that, 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 but this is acceptable. It's all content related question. Any question, guys? I know you got it. I just want to show you, demonstrate. And this is the last, I guess maybe there's another question. Which medication should the nurse question for a given diagnosis? It's the same thing. Your board is full of risk management. If I say risk management, this is what I'm talking about. This is risk management. You're trying to prevent harm. It's a safety question. You should be comfortable and you should master these kind of questions because it's a full of any intervention, all those things, intervention, see first, all this. If you're very comfortable, no matter what they throw at you, you just go to your content. Okay, you just throw your content. Heart failure, ibuprofen, diabetes, metoprolol, peptic ulcer, naproxen, glaucoma, diphenhydramine, hyperkalemia, spironolactone. What do you think? What do you think? What do you think? As you know, heart failure, well, NSAID, water retention. So it's going to worsen your heart failure. It's not good. Diabetes and metoprolol. Who knows the problem here? Diabetes and metoprolol. A patient with diabetes, you worry about hypoglycemia. What are the signs and symptoms of hypoglycemia? Tachycardia, right? Diaphoretic. All the signs and symptoms that everything goes up, right? Diaphoretic. You just basically everything is up. Guess what? What does beta blocker do? It puts you down. You can respond to tachycardia. You can respond to diaphoresis. All the signs and symptoms associated with hypoglycemia, beta blocker will block it. Therefore, a patient with diabetes, you should avoid things that will block the response to hypoglycemia. Therefore, methylpredol is not good in this patient. It's going to blunt the effect of hypoglycemia. Naproxen, peptic ulcer, you're going to bleed. Diphenhydramine and glaucoma. It's anticholinergic or antihistamine. It's an antihistamine. Glaucoma, you should avoid antihistamine. You see what is happening? Spironolactone is potassium sparing. K is up. The potassium is high. We got a question. So all of them, you have to worry about it. These are things you have to be comfortable. If you recognize them, then you know the pharmacology. If you know them, then you're on the way passing. So this is where you can. So all of them, we got to intervene. And the last question. And then it's provide care for a client with leukemia, 6 hours post-induction chemotherapy. Which of the following is concerning for tumor lysis syndrome? Once again, no matter what they ask you, don't freak out. Go for the buzzword. Tumor lysis. And he's getting chemotherapy. He has chemotherapy leukemia. And we blast the cells with chemotherapy. Guess what? The cell will burst open and all its content comes out. Every time you hear about tumor lysis, draw a cell and ask yourself, what is inside the cell and what is outside the cell? What is inside the cell? You have your potassium is high outside the cell. Your phosphorus is high inside the cell. Your nucleic acid is high inside the cell. Your calcium is high outside the cell, right? If the cell open up, potassium go up, your phosphorus goes up, your DNA, nucleic acid, so uric acid goes up. What is going to happen to your calcium? Go down because the phosphorus is going to kill them. And then all these go to your kidney and destroy your kidney. So your creatinine goes up, your BUN goes up, but your GFR goes down. This is tumor lysis syndrome. Therefore, what do you think? I've given you the content related to that. But you see what I did? I never even look at the answers. I did not look at the answers. I just try to know what I think is going to happen. I wrote it down. I compare it to the answers and I pick it. If you have to look at the answer and think about if it's right, you're wasting time. You have to keep on thinking at the same time. Sit down, maybe 5 seconds, write all the things you should expect, analyzing the question because it's a tumor lysis syndrome. Write all the things you know will happen, and then look at the answer choice later and say, oh, I should expect potassium to go up. It said it's up here. Phosphorus to go up. They say it's down. I know it's wrong. Uric acid to go up. They said it's up. Calcium to go down. They said it's up. It's wrong. GFR to go down. Oh, is it good? And those are the one pick. This is Adapting Class. Thank you for watching. If you're new, subscribe to our channel or join our membership or check my website for on-demand course. We'll have a crash course later. I don't have time right now. But thank you for watching. Good luck. Once again, don't forget test taking strategy and critical thinking when you're analyzing question. And go for your buzzword and be sharp as you select the answers. You'll be fine. Take care and good luck.